So this is week 3 already. Next week will be our first exam that we take. We are doing reviews. I did mine on Tuesday. Professor Morris did hers on Wednesday. And then Professor Okorafor has changed the review that was supposed to be tonight. She changed it to Saturday morning, 9 a.m. if you need to have a live review. If you look at the announcement, I give you one announcement and I will add on to that the next review. I don't like sending out 6 announcements telling you where the reviews are, sending you, the recordings, it's just very confusing. So I keep it in one place. So right now you have my review, you have Professor Morris's review, and I've also attached to that dosage calculation. I've also in your inbox have sent you 3 dosage calculation worksheets. If you need help, you need practice. And they all do have the answers on it, so it will help you. I taught dosage calc for, about 5 years. So I really understand dosage calc and I teach it very simple. Now, I don't do that ratio proportion analysis. I don't understand what that is. I do something very simple, but even if you do that ratio proportion, it also shows you how to pick out the numbers you're looking for. What do I need to give? What do I have on hand? And did it come in a quantity of something? So that is also there on your announcement sheet if you need it. Now, after the review on Saturday, I will also post that in the same place. And on the announcements, I always have your review. Your PowerPoint review is attached to that announcement also. So trying to keep you organized. Also on that announcement is 3 Kahoots, weeks 1, 2, and 3, so that everything you need to succeed for this exam is readily available for you. Now, if you're having issues with understanding any part of the review, any of the concepts, please make an appointment with me. I can sit down with you quickly. I can help you. I don't mind. If you're not understanding, I want to make you understand. And I try to do it very simplistically, make it easy for you to understand. Use those easy sort of examples to help. So if you need it, just holler. I'll make time for you, not a problem. So this week, week 3, it's quite amazing how quickly it goes. But this week there is a quiz number 2 that needs to be done. We're doing school age and adolescence, chapters 34, 35. The quiz has a little bit of last week's information on it, but it's stuff that is not unfamiliar for you at all. I've covered absolutely all of it. And so far, the students have been doing it, have actually been doing pretty good on their grades. Quiz 1 is always difficult because of the inflection of all the theorists, especially Piaget. Piaget is the most confusing, and I tend to agree with you. You have 50 NCLEX questions due, and make sure that your case study burns is in by Sunday so you don't get any sort of deduction from that. So today, as I said, we're going to do school age, adolescents. We're going to do our PowerPoint, and then we're going to do a Kahoots. We should be done about 20 minutes early, which is actually your time that I give back. You're supposed to give you break time, 10 minutes every hour. That's what Fortis says, part of the policies. I try to give it back to you as soon as I can, and today is actually one of those. Next week for the exam, come in on your phones on Zoom and have your computers to exam soft, okay? There will be a class to follow. I will be doing week 4's information, and I do it we'll be done with the exam and back, for class at, 7:20. At 7:20, we will, until 8 o'clock, we will go till then, and it will be a Kahoots. I have taken week 4 Kahoots and really narrowed it into the concepts you need to know. Instead of doing PowerPoint Kahoots, keeping you over, no, I'm going to work within the time, and you'll be getting a Kahoots for that study section that, me teaching you something. And again, as I do Kahoots, I'll be talking over the Kahoots, making you understand the concepts that the question is trying to show you. So let's go ahead and go for the PowerPoint. Get anybody with any questions, comments, concerns, anything? Okay, let's go. Let's start with the PowerPoint. So school-age children. School-age children is ages 6 to 12. It's 6 years. It's a broad span of age. It starts with the baby teeth coming out, and it ends with all the final teeth in and the beginning of puberty. Okay, puberty is different for girls than boys. What would you see with the first sighting of puberty in girls? And that would be breast buds. And what would you see that first sign of puberty for boys? And it would be the enlarged testicles, the scrotum would become enlarged. So those are the two things in puberty would be the first thing that you would see. Now, because it's 6 years of time, you'll see gradual growth and development. And these children at 6 are babies, and they have baby faces. By the time they become 12, they're more adults, and they appear more mature. Now, they will have more physical and emotional maturity, but remember, they're still 12 years old. There's still a lot of unknowns of how mature they really are. As I said, growth is slow, but if you look at 6 years of time, the total height is gained is 1 to 2 feet in those 6 years. And the weight doubles, but if you look at per year, it's slow. 2 inches a year height, 2 to 3 kilos per year in weight. So it progresses up. And boys and girls, same height, same weight, there's really not much different. Their movements become more graceful, they become more agile. They're starting with their legs longer, the body fat's going away, and they're getting more muscle. The head circumference and height relationship, it's, doesn't go there much anymore. As I said, their faces change, of course, from the 6-year-old to the 12-year-old. And I think the beginning, when you see all I want for Christmas is my 2 front teeth, is that age of all those loose teeth. I think children with missing those 2 front teeth are really cute. The maturation of their system. So you can go on a road trip, and they can hold their urine for a little bit more than an hour than they did when they were younger. Their heart, which filled their chest as an infant, now is smaller. It's getting smaller than the rest of the chest, getting more in relationship to the body. They've gotten most of their immunizations. Their immune system is so much better. They've gotten viruses and bacterial infections, and the body has built up all these immune bodies against it. So their immune systems are pretty good. Their bones, when they're infants, they're soft and malleable. That's why we can turn them on tummy time. The infants and their heads can start to round out. But when you get into the school age, and by the end of school age, their bones, they become, they're more ossified, they get a little bit more brittle, more stronger. They don't bend, they're not as malleable as the younger children. And the one thing we need to be careful for, just because they look mature, it doesn't mean that they're emotionally and socially mature. And we have to be careful when we're speaking to some of these older school-age children. So puberty, prepubescence, just know that puberty in girls start at age 10, and it's usually 2 years later, it's the boys. So the boys would be at 12 years old, and that's the beginning of puberty, usually. Now, as we're looking to do things for our school-age children, and we're teaching them and doing an assessment, when we're doing, say, sending a child for a chest X-ray. Now, a 6-year-old, you can say, well, we're just going to do a chest X-ray and you'll be right back. Well, you would say X-ray to some children, and what will they think? They think of these, super figures and heroes and X-ray eyes and these shooting lasers coming out, and they think it's a bad thing. They don't know. So let's put it down a little bit, get more on their developmental level so we don't scare them. So we're going to take a picture. It's a big, big camera, and they're going to put it over, let's say it's a fractured arm, put it over your arm. It's not going to fall. It's not going to hurt it. You're not going to feel it, but you're going to hear a beep when it's done. And I guess what? When you come back to your room, I'm going to show you what your lungs look like or what your arm look like. I'll show you if it's broken. And then it makes it fun, especially those younger school age children. The older one, even telling them, a lot of them, that it's just a picture. It doesn't hurt you. Actually can help because you don't know how, mature emotionally these children are. You're going to do an assessment by inspecting, auscultating, percussing, palpating. I know that in inspection, number one, I can look at a child and say, this kid is sick just by the way that they look and appear and the way that they act, but then of course, when you start listening and feeling, you can see some other things too, but just looking well appearing or not, easy. Lymph nodes, you should not feel them on a healthy child. If they're sick, that's when they inflame. When you want to do like your health assessment, assessment on a child, which we do, but we do a little differently. How do we do these things? Well, a hypoglossal nerve, how do you assess that on a child? Well, you stick their tongue out. You can even get an infant who likes to imitate you, about 4 months old. They'll stick their tongue out at you because they're trying to do what you're doing. Another thing with children is they've got these little short, straight eustachian tubes. They've got these big adenoids, big tonsils, and they get all this mucus just sits there and just, I call it gurgling in there. It's like all this upper airway mucus. And sometimes you don't know, is it lungs or is it in the upper airway? Okay. Now, we do this by listening to breath sounds in different places. We will do bronchial. So let's say that tube, the trachea and bronchus, that's just a tube from the upper airway, is that mucus noise up there. So we'll do bronchial lung sounds. If we want to listen to the real breath sounds, we would listen to the lower lobes, middle lobes of the lungs. But we would be able to see, is it that sound from this bronchial noise I'm hearing, or is it the lungs that sound like that? I mean, listening to the breath sounds on a child is not as easy as you think. Number one, they've got to sit down and let you do it. But number two, was it the upper airway I was listening to? Because there's a lot of referred sounds with children. They're smaller, things are closer together. So Freud. So I'm going to be talking about theorists and trying to let you understand them. Well, when we talk about Freud, mostly with Freud, we talk about infants. We don't as much talk about older children, but Freud is all about exploring the world through the mouth as an infant. They like to suck, bite, chew, similar to Piaget. But Piaget also is about the texture of what's in their mouth and then moving whatever they have, their hand, feet, whatever. That's the difference. Freud, then as a school age children, what he says about them is their relationships go to same-sex peers. It's all about their heterosexuality. Freud is all about, sexual, sexual type of development. Now, Erikson, the most picked upon theorist that you know, okay? Erikson, when we're talking about a school age child, is this sense of industry. And industry means they can perform a task well. What is the task? What is it? Well, it could be they're great at math. They're great at spelling. They can bake a cake. They can play a piano. They sing. Or maybe it's the sports. They can kick the ball, throw the ball, hit the ball better than anyone. They feel good. I can do that. That's my sense of industry. I can perform those tasks. It makes me feel good. And it does, when you feel good about something and you're good at it, what are you going to get? Praise from your peers and from everybody. Now, the other side, when you talk about industry, is inferiority. So what's this inferiority about? We're doing these tasks really well, right? Well, the inferiority is when you can't do everything well. They want to do everything and do it well. They like to please, but because they can't, they feel inferior. They may be great at sports, but they're terrible at math. And because they can't do math well, that makes them feel inferior. So does that help you understand industry versus inferiority? Makes sense that way. Now, Piaget at this point says they uses past experiences and builds upon them, and takes a past experience to have more understanding and figure out relationships between other stuff that's similar to it. One of the things is that master of conservation. Now, I describe conservation as this. I had 2 young children. On Fridays, I would go to the store, which a lot of people do on Friday or Saturday. They get their weekly groceries, and I would buy 2 boxes of Little Debbie's cakes. And each box had 10 things in it. And this was for them when they came home from school. They had a snack to snack before they had dinner. They knew by conservation, if they ate them all in one day, there'll be nothing left for next Friday because they're gone. And I'm not going to the store. It ain't going to happen. I don't have money for it, and it's not going to happen. This is what you have. If you eat it now, it's gone. That's conservation. Some other ways they understand is taking 2 glasses, one tall, one short and stubby, and put the liquid from the short and stubby in the tall. And it looks like the tall has more liquid than the short one, but these children understand cognitively. They're aware that it's the same water. It's just a different shape. Just like a ball of clay, and then you smash it down, it's still the same amount of clay. It's also with patterns. You put like 10 pennies in a pattern, or you put them out of that pattern, it doesn't matter, it's still 10 pennies. They're understanding these things. Now, Kohlberg, remember Kohlberg is good and bad and a consequence for each, which is reward and punishment, right? And these children also know why people do good things and why they do bad things now. And actually, these children do sometimes want to do something, and they know there's a punishment, but they wanted to do it, that they'll take the punishment in order to do it. And because they're now rationalizing with Kohlberg and that sense of conscious. And they also now are worried about other people. They're starting to worry about the feelings of other people with this doing good and doing bad. Spirituality, they're very concrete in their terms. What do they know? It's what they've seen or been shown. If they know that Christmas is a Christmas tree and that it's presents, and then you have to go to church and I fall asleep at night and come home, and then when I wake up, Santa Claus is there, well, that's what they know. If they know about the manger and Jesus, that's what they know. If it's another religion and they're lighting candles, that's what they know. That's concrete. They understand that there is some God that makes them do good, okay? Whether it's that super ego or a God that makes them do good, whatever the name is, okay? Children at this age, school-age children, feel that if they do something wrong, something bad's going to happen to them. I'm going to give you a good example. Working in the emergency room the last 10 years of my career, saw many young school-age children that 6 to 9 years old who had came in with abdominal pain, and it ended up being their appendix, and they needed to go to surgery. Now, because I understand that they feel that God is punishing them, I remember sitting down next to them and telling them, you did nothing wrong, okay? You're not being punished. This is something, that little piece of thing in your tummy just didn't want to be there anymore. And he's saying, please just get me out. So it wasn't that you hit your sister. It wasn't that you didn't do well on your exam. You're not being punished. And then the other thing I tell these children is, I will make sure that that surgeon puts an extra stitch so your insides don't come falling out. Because they also believe that if they're bleeding, all the blood comes out and that their insides will be falling out at the early part of the school age children. Peer groups are so important, and now they're starting to do after school activities, whether it's sports or clubs. They really want to be with their peers. Now think about this. These children have been in the home, protected, rarely allowed except for school, preschool. Now they're getting into clubs. They're getting their children now have friends that are their peers, and they're being involved in their life. They're starting to break away from the home. And what these things that they're doing is preparing them when they get older and when they move out of the house, when they go away to college, or when they, go out and get their own homes. Clubs and peers groups are important. It is a group. You have to be able to get along with these children. You need to listen to directions, and there's goals. And like for Girl Scouts, you're winning badges. But again, with any of these sort of groups, whether it's sports or clubs, you got to be worried about bullying, because there always will be one kid that's like, I got more badges than you do, or you didn't get that badge because of na 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 na, and it will happen. And it's unfortunate, but that's human life. I mean, we're going to be, as people, as we get older and on our own, we're going to have people who are going to do that too. So we're going to be having these families. At this point, parents should be there to intervene in that bullying. That child should be able to speak to that parent. Now, the parent is still a parent. They don't need to be a friend. They still need to allow the independence away from them, but they need to be there, to talk about what's happening so that they're involved that way. But you're sort of not totally intrusive. Play, as I said, I went to work and played for how many years? But as children, it's that rules, it's the rituals, it's working together with other children, or it's by yourself, playing by yourself, being able to entertain yourself, and it's being able to feel good about yourself, like learning a piano, learning how to play it well. I mean, those things children feel good about, or playing a video game well. That's another thing. You're starting to learn, like, the self-concept awareness about what I can do. It's that self-perception. It's their abilities, their values, their appearance. They're starting to see who they are, and they're paying more attention to this. And adults are really important at this time, that they notice these abilities, the appearances, and make comments about them, because this promotes that respect, that self-respect that they need, that self-confidence that they need. So significant adults, whether it's teachers or the families or grandparents, it's important that they let these children know that they're aware of how well they do something. Their body image is not as strict as the adolescents now, but they're starting to learn it, the differences in them. They're starting to notice things, the hair, the eyes, skinny, short, fat. They are starting to see things like, oh, you have glasses on, you have a hearing aid, oh, you got braces. They're starting to notice, they're starting to see that bodies are all different. They're starting to be aware of other things beyond themselves. So, as I said, going to school is that sharp break from family, house, and protection. And now we have other people that are involved in shaping this child's life. And it is part of that child's development to when they are old enough to be able to break away and be on their own. So they're learning not only that what your family believes in, but they're also seeing it from other children. Other children are, showing them what they believe in, different things, and that people are different. Nutrition is always important. One of the things with school age children is that these children love to learn. They love programs to teach them things, to teach them how to eat right. This My Plate online is a great thing that many of the elementary schools are introducing to these children and showing them how to eat properly. I mean, today, if you're a parent, single parent, or even two parents, it is hard to be able to do everything you need to do in a day. So many times it's run through the fast food to come home and it's dinner. And there's nothing wrong with it, but it can be too many calories for the children, especially if these children are not as active as they should be. So fast food can be a concern, although many a days that's all there is. It's either that or peanut butter and jelly. I mean, I've been there, I know it. So that the school age children do have the ability to be on the heavier side. And it is reaching now epidemic proportions because of what? Well, it's that fast food day because two parents are working and it's the easiest sometimes, and sometimes many times, and a lot of times it's cheaper than actually cooking food. But one of the main things is technology. Children today are using computers, video games, telephones, and they're not up and out and in the neighborhood. It could be, though, due to an unsafe environment, though. That's the one time, you would say, well, yeah, you can't be outside playing like the way that you'd like to. But the one thing about overweight children, this these children have an increased risk of high blood pressure, diabetes, high cholesterol, because their bodies go through this cardiometabolic changes because they're overweight. So if we have school age children overweight, they will turn into be adults that are going to have some medical problems. So how do we take care of this epidemic that's going on with our children being heavier? Well, we should be worried about nutrition from, into utero, into birth, the first year for sure. These obesity hits all ethnic groups. There's not just one set. No, it hits everybody out there. And, teaching school age children has really shown a lot of success. There's a lot of programs that, I noticed that were in the school age times. I mean, Dare to Keep Kids Off Drugs. And, now they're doing outside for 30 minutes. It's all these healthy people things that have been coming down that schools and some parents are trying to do. But the one thing that's been said that school age children should not be made to eat what's all on their plate. And the reason is this, I have found children eat all they want to eat and they don't need as much as sometimes we as parents make them eat. Okay. When you force a child to finish what's on their plate, they become adults who can never not finish their plate. They always do. So that overweight child can become the overweight adult because they are in the habit of always finishing their plates. So school age children should rest 9 to 11 hours a day. Now, the older ones, maybe, we know those younger children are going to fight it, those 6 to 8 or 9 years old, they're still going to fight. Yeah, I don't want to go yet. Oh, I want to do this. Oh, I need a glass of water. Oh, I need to. And, they'll fight bedtime, and it's just the normal children. But as they get older, up to 11, 12, and that's usually when they're saying, Mom, I'll go to bed. But rarely these children are getting those 9, 11 hours during school, especially school nights. Sports, as I said, or clubs can be very controversial. You have to be careful that the child is ready and able to do sports. that they have that physical and emotional maturity. They've, number one, got to do a lot of physicality. They also have to be mature enough to understand the sport, how to win, how to lose, and to play with other children, and play as a team. But children love to win. I mean, my grandson's been coming home since he's age 3. Did I win? I won, right? I won the game. Or he changes the rules so he wins. That's just what they do. Dental health. School-age children should be brushing their teeth at night before they go to bed. The younger school-age children cannot coordinate flossing yet. The older ones should floss their teeth. But if in general they brush their teeth, it's going to decrease the amount of cavities. Now, one of the things, I mean, we can get braces, malocclusion, all of those things, and those teeth, it's no more all of the tinsel mouth anymore. They've got all of these really neat braces that you can use today. But one of the things that can happen is children fall and the whole tooth comes out of their mouth right down to the root. And it's usually one of the 2 front teeth, guaranteed. So what do? How do you, take care of this, especially if this is a permanent tooth? It's not a baby tooth. This is now a permanent tooth. They fell down and their mouth hit the ground and the tooth popped out and they come crying with the tooth in the hand. Mom, my tooth fell out. What do you do?
Put it in a glass of milk.
Put it in some milk.
Absolutely. You put it in a glass of cold milk and you bring it to either a dentist or an emergency room. And what they do is they numb the area with, a topical gel, and they leave it in there and keep it in there as long as they can. And then the dentist comes and pushes it back up in there. Many times these teeth catch, they re-catch on. They don't need a post-it and a false tooth and all the things that could be, because the front tooth, permanent tooth came out. And it could save a lot of money if we could just push that thing in there. And all they do is put them on a very soft diet for a week until it settles in and then slowly increases. They're not going to be biting an apple for a while until that tooth is really good and in there. But I've seen them work. Sex education, they're becoming more and more curious. And it's actually, as I said, school-age children, it's a great time to teach. So this is a time where the school or parents should be introducing sex and sexuality and good communication about touch and improper touches and all of those things, so children are protected. As a nurse, what do? Well, we need to, let them know sex is normal. It's nothing dirty, nasty, because, depending, where this child's thought is, and just answer questions. Don't assume a child understands exactly what they're talking about. Let them explain to you first, and then you answer the questions from there. And it should be an open communication with parents, but the school nurse is that good secondhand person to hold these children's hand and talk about sex and sexuality. Many parents can't talk to their children. I know my parents, I was talking nothing about sex to them as a teenager or school age children. No, it's just something that wasn't done. But, there's always the school nurse there. So school health. Many of you, looking for jobs, some of you should think about being a school nurse. It's a great job. It is, you're off all the holidays with the kids, right? You'll be off summer break and Christmas break and all of those days if you want. It's just a great thing. Now, school nurse, their roles have expanded through the years. I mean, when COVID came out, they were the people that kept the community aware of what was the requirements to go to school and mask and putting up partitions and, giving out information. I mean, that was huge. But on other times, it's getting the child to the office who has ADHD and helping parents getting help. Or maybe it's that child who was admitted to the hospital with meningitis and then notifying the other parents of children that could have been around that child to go get a prophylactic antibiotic, to be safe. I mean, they do a lot of things. The school health is a great place for school age and adolescents to talk about sex, sexuality, and things of that. And what would a nurse tell? Let's say these school age, depending on the questions, or even that adolescent, all you do is don't give your opinions. You give information in oral and written form so that they can go and they can investigate also. So you send them in the right direction. Could be to, Planned Parenthood, right? Injury prevention, big. Again, motor vehicle, any age group. School age children should sit in the rear seat till 13 years old. Many, I know I didn't have my children in the rear seat till then. Booster seats till they're 8 years old. All children wearing bicycles should wear helmets, and all safety equipment should be worn for any different sport. Remember when those little hovercrafts came in where you just move your feet and they just spin along and go real fast? Well, that first Christmas, I had two boys. They were 11, 12, in that area. They both had fallen, put their hands out, had bilateral fractured radial ulnars, both arms. They ended up with 2 casts on their wrists because they didn't have those wrist protectors on, which should be if you're on one of those hovercraft, scooters, skateboards sort of things. And trampolines are not recommended at all. So parents in school age children, it's sort of hard where you've had your child to yourself and you've influenced completely. And now you're starting to have teachers involved, after school activities, sports leaders, their peers, families are really starting to becoming involved, and it's hard for a parent to let go. So what should a parent do? It is said they should provide support and be unobtrusive as possible, as in be there, but don't let the child, seem like they're, living their life. But, behind the scenes, the parent is always there, because we've started with just a family. Now we're learning about more and more different sort of people as we go. And so it's that narrow family, and now we're opening their horizons to different people, different cultures, different people. One of the things in school age, which is difficult for the teacher, for the child, for the school nurse, is ADHD, attention deficit hyperactivity disorder. This child cannot sit in one place, cannot finish a task, and in school is usually up and out of the chair and causing chaos in the classroom. Many of these children are sent to the school nurse. And then what does the school nurse do? Well, number one, many of these children, these parents have been trying to work with this child for a long time. Don't ever assume that the parents have done nothing, or that the kid is just spoiled. He just wants to do and he wants to do it. Don't ever think those things. Many parents have jumped through hoops trying to get these kids care, and still are really struggling. So what do? Number one, listen to what the parents tells you. So what have you done to try to help your son, your daughter? And listen to all of that, okay? So never assume. Then ask them, what do you need for your child to help? Make a plan of care from what the parents have said. So now they've told you, we've been to psychologists, we didn't want to try meds, and, I don't know if we should, and help them, make decisions, help make a plan of care that will benefit the child and the parents, because the parents have been working with this child trying to help. So we already know that an avulsed tooth goes in cold milk, right? Adolescence. I call this hang on to the roller coaster. It'll end, and then adolescence will be great again. Adolescence is a difficult time in life. It is a transition between childhood and adulthood. It is characterized by rapid physical, cognitive, social, and emotional maturation. They go from being a kid at age 12, going into 13, and then at 18, they need to act like adults and go away to college or move out on their own or get a job after school. So they go from child to an adult in a very short period of time. So it's hard. It's going through this whole body and all of these changes. The beginning of children becoming is that puberty, when they get into the adolescence. Boys, the first pubescent change that we'll see is that testicular enlargement, and girls will be the breast buds. So then we know these children are going through puberty. There's going to be changes. And we know they go from being children to being adults as characterized by these pictures. This is part of Tanner's sexual, changes that have been done. The physical growth with adolescence. Now, in the beginning, in that puberty time, these children grow 20 to 25% of their total height in 2 to 3 years. That is pretty quick because they've only got 2 inches, a year all through your school age, right? Now you have 25% of your height is in 2 to 3 years. Can you imagine how much nutrition these children need to eat? These children are getting taller, they're becoming more mature, becoming more maturated, and they need rest and they need nutrition at this point. Doesn't mean they're going to get it though. Now, Erickson talks about a sense of identity. Who is Erickson? Well, he says, what does identity mean? Well, identity is who am I? What am I going to be? What do I want to do when I grow up? Do I like me? Body image is horrible then. They want more. So their identity, they're still looking, what is my image going to be? Do I like girls? Do I like boys? Do I like both? Do I like none? Which peer group do I fit into? What music do I like? There's just so many decisions to make as an adolescent, and it's looking for, who am I? What is my identity? So adolescents, they go from being, with a parent and guiding them, and now they're gonna go into wanting to do what they want, okay? So they want to make their own choices and don't want the parents to help them. They don't want the parents' authority over them, but they want to be independent. So at this point, they still love their parents, right? They're still their parents, but they're like, Mom, you just don't understand. I need to go out and I'll be home when I get there. If something's wrong, I'll call you. Well, parent doesn't want to hear that. They want to hear where you going, what are you doing, who are you with, what time you coming back, who's driving, do they have a license, all the way down the line. So it's hard. Now, social development, you see intense sociability. The adolescents are in school, they're in clubs, they're in sports, they're going to the mall, they're going to the movies, they're meeting here, there, they're doing all of these social activities. And then you see intense loneliness. Well, there are periods of time where you thought your best friend was your best friend, and then you were talking to this guy that you liked, and you really wanted to go out with them, and then you found your best friend kissing this guy. Now you've lost what? You've lost your best friend because they kissed the guy that you liked and wanted to go out with, and then you lost this guy because he's already with a friend, so now I'm lonely. And now it's, that depression, and now I've got to find another social group, a peer group to hang with, because now some of my peer group is gone because of what they've done. Now that's the intense loneliness. And again, they want to be accepted by their peers. They don't want, that loneliness that's gone on. The relationship with the parents, as I said, you're protecting them, And now you need to let them have a little control. But with the control comes, you get that privilege, but the responsibilities need to be met. So teenagers, they want all the privileges, but they don't want the responsibility. And the responsibility is whatever the parent makes it. It could be you need to take the garbage out. You need to make your bed, put your clothes away, clean your room, whatever, do well in school, you know, those things. And then you can go out on Friday night to the movies, da 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 da. Okay. Sometimes they don't want to do what they need to do to get there. They just want to be able to go. Now, there are major, major conflicts over the independence and control about ages 15 to 17. They're not the younger part of adolescence. They're in that middle stage, not the younger, not the older. They're not 18 yet, but they want independence and control over their lives. So these are those major conflicts. What would you as a nurse tell a parent? Well, at this point, the parents and the child need to sit down and come to an agreement. You know, what is, you know, the limit? What do I need to do to let him go? Or what does he need to do so I'm okay? And sometimes that's just very hard. It's nice to be said, but sometimes it can't happen. So parents, again, you say peers. Peers are very important. So adolescents like to be with peers. Why? They feel a sense of belonging, of feeling strength and power, you know, and they feel really good because they are, you know, away from the parents and they're showing their own independence. Best friends are usually same sex, you know, friends. One of the things about best friends is that how you treat your best friend as an adolescent is how you'll treat your partner for life. So if you're good to your best friend, your partner in life will be treated good too. And if you don't respect a lot of things with your best friend, same thing's going to happen in partners for life. It seems to be a correlation in research that's been done. So how are you going to talk to these adolescents? They know everything. They don't want to do what you say, and they want their own freedom. That's what they want. So now you have this child in a doctor's office or in an urgent care or somewhere, and you need to talk to them. Well, number one, you got to build a rapport of some way, either talking about social activities. I find that if they're listening to music, which many of them do to, you know, drown out their parents talking, I'll ask them, so what are you listening to? You know, what sort of music is that? You know, have you seen them in concert? That's an icebreaker there. Or if they're wearing like, you know, the newest Nikes or something, I'll mention the sneakers or something about them that will, you know, make them relax with me and say, no, she's not a threat. She seems to be pretty okay. Another thing that can happen, and I know this because I have my stepdaughter, you know, her name is Rachel, and I love her to death, but she is more on the masculine side. And I noticed that. So now she wants to be called Ray. Now, if you see that within your practice and you see a girl or a boy, either way, just talk, dressing in a different manner, the best thing to do for that person is to ask them, how would you like me to address you? What is your name? And I'm telling you, you'll build up more respect with that because you have respected the difference. And you did it in a nice way. Okay. Always ask the patient, the client, the adolescent, always talk to them because they will open up because you've mentioned it, you know, and they're actually pretty happy to do it most of the time. Immunizations, HPV, we're going to give it about age 9, and we can give it to boys also. Nutrition. Well, adolescents don't eat. What do? grab a bottle of water and a snack bar and run because they don't have time to eat. And during lunch, they're going to be going to here because they have to do that for this project. And so they're not eating well. So what's going to happen with that nutrition? Well, it's not going to be as it should. Now, what happens if now there's an issue and it regards nutrition? This is that person that you need to do a 24-hour diary of food. You need to see what they're eating, because if you don't know what they're eating, how can you change it? And because they're not eating breakfast, lunch, and dinner and snacks, they're having water and a snack bar and maybe dinner, if you're lucky. So making sure that we do get that 24-hour diary will give us some guide to maybe what are some of the issues and why is it causing that to their health. Now, adolescents should sleep a lot, right? They're going through this big growth spurt. They don't. Why? Because there's so much social activity going on, schoolwork, friends, boyfriends, girlfriends, that they don't sleep. So they're not getting the rest they should. They should exercise. Well, they're so busy with everything, they're really not doing exercise the way they should. Thank goodness they are active. They get up, they go to school, they walk around, they're in activities. Okay, that's good. And again, dental health. Adolescents should be able to brush their teeth and floss it, and keeping their mouth healthy is very important. You don't have good teeth, it's going to affect your whole body. Sexuality, we know today TV has everything right there. There's no figuring out, well, I don't know what they're doing. Well, we do today. It's very vivid. So, a lot of adolescents, they're becoming sexually active and they need information. As I said, if they come to you as a nurse, you can give them oral and written information. Do not put your opinions in there, okay? Parents should be number one if they're going to talk to them. As I said, my parents would never talk to me. So, school nurses were my avenue, or those Planned Parenthood, but school nurses are a great resource for them. Again, adolescents, injury, motor vehicles, right? But the other one is firearms because of those risky behaviors. And then they're trying to be the best at sports, so sports injuries, so injury prevention. So Matt, age 14, remember what happens at age 14. Seems to be always eating, although his weight is appropriate for his height. The best explanation for this is what? 14, when is that? That adolescent growth spurt time? He should be eating, right? So it is normal, absolutely normal. The answer is A. So that was today's PowerPoint. Who wants to win the Kahoots today? Sean, are you going to win? Maybe?
Probably not. Not today. Maybe next
How
week.
about you, Lindsay? Maybe?
Maybe.
How about you, Angel? Hassan, how about you? Maybe, maybe not, huh? Okay. All right, let's go and let's do our Kahoots, and then we'll be done for today. Three, 5, 9, 3, 7, 9, 4. All right, let's get her going. School age, adolescent children, 6 to adult. How does the onset of pubertal growth spurt compare in boys and girls? So boys and girls is about 2 years difference, and you could usually say ages 10 for girls and 12 for boys. An angel went up top. At what age should a parent expect to have major conflicts over independence and control with their child? So this is the ages 15 to 17. It's not the younger adolescent. It's not the older. It's that I'm almost there, but I want to do what I want. Okay, leave me alone. I'm okay. I'm an adult. I can handle this. No, they can't. Not yet. The onset of puberty in boys is characterized by and that's testicular enlargement. I mean, the voice does change and the pubic hair comes, but the first thing that happens, testicular enlargement. Signs of onset of puberty in girls is and that's development of breast buds. Okay, so when you see girls getting breast buds, they're going through puberty. And if you were in a physician office and you had been checking the genitalia on a boy, you see a change, well, they're going through puberty too. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Can I tell you all ages of children? And it's motor vehicles. Motor vehicles, any level of child, they're always the ones, the source of injury the most is motor vehicles. And adolescents are now driving, so now they have more chance of injury. If a parent feels uncomfortable talking about sex education, who's a good resource? And that's absolutely the school nurse. Getting it from their siblings, from peers, it's not accurate information, and, having good information is very important, preventing of, sexual transmitted diseases and HIV, hepatitis, etc. A 9-year-old friend tells him soccer is a dumb game. He should play baseball. What's that all about? So when you're 9, you are very into, same sex peers and friends, and you'll do things to please them, to keep them together because they're so important to you. During admission, the father of a 16-year-old says, "We are Buddhist. Culturally competent and care includes what?" And the dad says they're Buddhist. What would you do? And if they're Buddhist, he's trying to tell you something. So ask him, what do you need? Is it a diet? Is it, how we deal with your daughter, your son? If you ask, you are getting more respect, and then you're not going to make a mistake at all, right? When teaching sex education and contraceptive for adolescents, what should the nurse consider? So they need information in the oral and written form. None of what you're feeling, but give them information. A multi-select. The management of adolescent obesity should include So in an adolescent, we know they don't eat right. So a 24-hour diary, absolutely. And then putting some of those favorite foods in the diet will make it more realistic. When you're talking diversion, you're usually talking about younger children using diversional activities, not adolescents. And does an adolescent want nutritious food as a reward? No, they want to be able to have the reward by something they like. It not necessarily is nutritious. Infants go through predictable sequence of growth and development, and this is called, you will see me pull back from another lecture and throw some concepts in here. These are important concepts. So the sequence of growth and development is called sequential trends. It is actually that easy. It's that they roll and then they're on their knees and then they crawl and then they're crawling and then they're creeping and they're walking, and all of these things are predictable. It is a sequence that they go through in growth and development, and it is called sequential trends. Which of the following drugs is the most common drug of abuse in the adolescent population? And it is alcohol. You could say marijuana is there too, but alcohol is easy to get. Most parents might have a liquor cabinet. They go get it. They pour what they want, fill it back up with water, and keep going. I've seen that done many a time with adolescents. I see some head shaking. Yeah. That's why I didn't keep a liquor cabinet in my house. Which benchmark serves as the end period for the middle years of development? So the end of school age. What do we know happens at the end of school age? We know the beginning is the shedding of all the baby teeth. And when we end up, we have all of our permanent teeth, and it is also the onset of puberty. And girls will see the breast buds, and boys, the enlarged testicle, the scrotum. An example of indirect bullying would be what? This is something I didn't have to deal with when I was growing up. It's bad enough when they're talking it right to your face, or even, that you can hear what they're saying, but then to get it on social media, there's been programs that have shown that this bullying done on social media has actually caused some children to get so depressed they committed suicide. So social media bullying is a big deal. It has happened. What action would improve dental health in the school-age children? And it's actually the older children. So the older school-age children, not the younger. So the older children should be brushing their teeth and flossing. The younger school-age children, they don't have the mobility yet, the dexterity to do flossing, okay? So if getting all school-age children to brush their teeth, that is a good thing. And then adolescents, you can put in flossing. Generally, the earliest age at which puberty begins is and it's a 2 years different, 10 in girls, 12 in boys, yes. An 8-year-old girl says that she has cancer because God is punishing her for being bad. What does this mean? So this is like the children with the appendix, me telling them, listen, you did nothing wrong. It's just that little piece of tissue didn't want to be there no more. It wasn't that you hit your brother or you did something wrong. Absolutely a common belief at this age. And I hope if anyone has a kid, going through something like this, they're going to tell them, you did nothing wrong. It's okay. A 5-year-old needs a chest x-ray. What explanation is best? 5-year-old, 6-year-old, 7-year-old? What would you tell them? The gamma rays are going to come out and get you. And we, taking an x-ray, we're not going to use those words because they think of things coming out and, zapping you with lights and lasers. To tell them it doesn't hurt doesn't mean anything to them. But a large camera, take a picture, it's not going to hurt you, and then tell them, I'll show it to you when you come back to your room. That's okay. And they're not going to be nervous and you'll be able to get the x-ray done easily. How do you get an adolescent to open up about their sexual history? So the first thing you're going to do is, tell me about you. What's your social life? What's your music? What are you doing in school? Are you going to college? Whatever. Start there, break the ice, and then you're able to ask more. And then the other thing we do with adolescents, we have parents leave the room, and we do not have to tell those parents what those children have said, unless it's something that will hurt them or others. Okay? But they can talk to us in confidence about their sexual prowess. And let me tell you, sometimes they will shock you. So be prepared not to have your jaw drop. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? And first of all, have the parents leave the room. And then you can get on their level and you can get information out of them. They're actually very willing to share. A multi-select. When educating adolescents about the risk for HIV and hepatitis, what would you include? The adolescents, you teach them about abstinence, hand washing, condoms, and let them know about the risks, without using just condoms, and, abstinence is always the best. A child has a knocked out tooth. Where should the tooth be placed? For transport to the dentist. And Jeanette knows that one. Put it in cold milk, get it there, and then they're able to reimplant, and that's a lot better for the child. A nurse planning care for a school-age child should know which thought process is seen. School-age children. So this is that ability to conserve. This is those little Debbie cakes that they made sure it lasted all week long, or the milk and for the cereal, we have enough for all week long. When you talk magical thinking, animism, those are your preschoolers. And then thoughts are powerful. I think that's more when you're going for your priesthood. It's not that strong like that in Piaget. What stage of Erikson would you use for a school-age child? What do you know about school-age children? Erikson. They like to do things well. They like to please. They like to be peers, to accept them that they're doing something good. And that's industry. And then the other part is school-age children cannot do everything well, so they feel inferior. So it is industry versus inferiority. If you all don't know this, this is something you really need to review well. Trust versus mistrust is going to be your infant. Am I getting my bottle on time? And autonomy versus shame and doubt is your preschool or your toddlers. And your toddlers, the autonomy is they're allowed to do things, and they can maybe put their shoes by the door, their laundry in the basket, little things. And that shame and doubt is when the parents don't let them try. They want to dive bomb off the couch over to the other chair and be a plane, and mommy and daddy says no. And that's when they have shame and doubt. So you need to know these things. You will see them again. A multi-select. Anorexia nervosa is characterized by, I put in a couple slides about some eating disorders. I think it covers it exactly what we need. So anorexia nervosa is all about nothing in the mouth. They don't even want to put toothpaste in the mouth. They're afraid that it has calories. As a leaf of lettuce, water, they feel they're so fat and they're all bones. And then of course it's over exercising too. So anorexia is no food in the mouth at all and burning calories as much as possible. How do you know if you suffer from bulimia? The other. Bulimia is when you eat, but you keep vomiting the food out so you don't gain weight from it. Now I ask you, what's the difference between anorexia and bulimia? You have two adolescents. They both look alike. How would you know one was anorexic and the other was bulimic? I would say, look at the teeth. The teeth will be from all the gastric juices. They'll be rotten and there'll be cavities, and the calcium and enamel will be very poor in appearance. So bulimia, you're going to see the teeth not good. In anorexia, they're just going to be really, really skinny. They'll have good teeth, but bulimic has those bad teeth. The leading cause of death from unintentional injuries in children is, I think you understand this one well now. So we know it's motor vehicle accidents, children, any of them. Adolescents are. Just hold on for the roller coaster ride, as I called it. It's somewhere between that childhood and adulthood. And it's also a time of multiple turmoil and confusion, and they're troubled and they're frustrated. It's a hard time of life for the child and for the parents. What is an adolescent's heart rate? I mean, most adolescents are just about an adult, but they've got a younger heart. So you see that 55 to 90 would be it. 120, they have a fever at that point. It should be almost like an adult, okay? But slightly lower in values because the younger heart. And Sally's on fire. When talking with an adolescent regarding personal health concerns, which is most important? You have a young girl who's in there and she keeps having urinary tract infections, and you're talking to her. And she's finally opening up to you. And the biggest thing is let them get it out. Let them be honest and open and share. And one of the things, as I said, be prepared. You're going to hear things that will shock you. Try not to look shocked, because that's what they're looking for a lot of times. A parent says the infant puts everything in the mouth. Based on Freud's theory, you would respond how? Why, according to Freud, do infants put everything in their mouth? And they explore the world that way. This is the way they explore, and it's in their mouth. That's Freud, only oral things. And then we know Piaget talks about the touch, the texture, hard, cold, soft, in the mouth, and then moving it around and moving it. Slightly different, but very similar. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are. Well, think about adolescents. We know they're in that stage of confusion and frustration, and their body image and, intense loneliness that goes on. Homicide because of risky behaviors, and suicide because of the depression that they can get themselves in. In school age conflict of industry versus inferiority, what does industry mean? Remember, industry is whatever they can do well. It's that mastering a task, whatever it is, whether it is, sports, whether it is schoolwork, whether it's cooking, musicality, whatever it is, they master it and do it well. Makes them feel good. At what age does intuitive thought start? They can start putting things together. And this is at the very, very beginning of the school age. It's that 5 to 7 years. They're starting to be able to put things together and understand things a lot more. Which age group prefers to be with members of their own sex? As Freud and heterosexuality, right? And that's your school age children, the later of the school age children. that really important if they're with their own sex. Same-sex peers. Which age group would have a tendency towards eating disorders? And that's your adolescents, not down to the school age children yet, but you never know. True or false? Home support is invaluable to the adolescent. Do they need mom and dad at home? Do they need them to support them? And I'm not just talking financially. And they absolutely do. What happens if their best friend was kissing the boy that she liked, and now she don't have any friends, and now she's very lonely? She needs mom and dad to talk to. She needs that support to make her feel like she's worth something and she is special.
So wouldn't that mean that it's valuable then instead of invaluable?
Yeah, I think that one was just worded wrong.
Well, what it means, it's invaluable, which means it's beyond valuable. It's
Okay.
absolutely what they absolutely need. Invaluable.
Okay.
Okay. Contraindication to administering the varicella vaccine to an adolescent. Now, I throw this one in here because it's a question you're going to see, I guarantee, probably on your NCLEX. And it's talking about what a varicella vaccine is. Remember, it is a live vaccine. What do you know about live vaccines? And what do you know about one of these answers that makes a person immunosuppressed? It's steroids. So live vaccines you can't give to an immunosuppressed patient, which there's a bunch of diagnoses, but steroids also renders them immunosuppressed. So remember that question. You will see that again somewhere, maybe in your med search. To improve adolescent health, adults must increase health enhancing behaviors such as adolescents, they're on the move constantly, right? But they need to eat better, they need to exercise, and they need better sleep. Doesn't mean they're getting it because they're so busy with school and social activities, they don't have time. What clinical findings does not indicate an adolescent may be suffering from anorexia nervosa? Does not indicate that the adolescent suffers from anorexia nervosa. I think 3 of these look like another symptoms to hypothyroidism, isn't it? It's very clear, and it's lack of, proper nutrition, but decaying teeth is bulimia. It is absolutely not anorexia nervosa. I changed that around to give you that concept in a different way. The risk of depression in transgender children is what? This is becoming more on the forefront because of some of these reality TVs out there, but the risk is increased, absolutely, because they're looking for acceptance, and not everybody accepts. A 14-year-old in the ED after a biking accident, how should the nurse interact with the adolescent? I used to work, in an ER, and I was the trauma primary nurse many a weekend when I was working, and getting a child in on a backboard with a neck brace and taped to the board. And, parents aren't there yet and they're scared. And all I found is as I'm, everybody comes and attacks at once. We want to make sure there's no internal injuries, there's no broken bones, fractured ribs, internal injuries. It's pretty quick what they do. So I would stand there and just tell them, okay, a lot's going to happen. Okay, we're going to do this, we're going to do that. You're okay, your mom just got here, don't worry, somebody's with her, just to keep that child calm during the whole thing. And an adolescent, they just want information. They just want to know what's coming next. Cooperative play. What is that? What does cooperative play mean? As I said on the exam, you're going to see things about play. I mean, I threw one on here too, just to open the mind to it. Associative play, parallel play, solitary play, cooperative play. So cooperative play is when two children work together and they are going to reach a goal, whether it's playing checkers, somebody wins a board game, or it could be, I'm going to build a house together. We're going to do it like this. And when we're done, the house is built. So that's your goal. So cooperative play. What does moral development involve? What did I tell you about moral? Who's moral? Which theorist always talks about morality? And what does that mean? It's all about right or wrong and a consequence for it. And as they get older, it's being able to fit into society, knowing what's right and what's wrong so that they can fit in and adjust to the situation. Developmental milestones are important to observe because I'm going to give you some questions from past weeks. Make sure that you understand them. I mean, we're learning all of these things, turning over and sitting up and pincer grasp and building blocks and growing. And how do you remember all of this? Well, when we understand the progression, that sequential progression that we should know, when they're not getting there, something's wrong. And we can institute early intervention. Children are resilient and you can catch them up, most of them pretty quick. And with early intervention, even the most severe Downs or autistic children can become a lot more than you could ever imagine through early intervention. Lymph nodes in children with normal findings, what does it feel like? And you shouldn't be able to feel those at all. Good. Giving you a couple things here now to think about. Right second intercostal space, landmark of the heart is called what? So one of the chapters in the book had to do with about assessment. So I'm throwing in some areas of assessment and you need to refresh. You need to look at it because these are questions you will see. So that is the aortic valve. So right second intercostal is aortic. So in the study guide PowerPoint, you're going to see another chart with all of them. So please study that. And Fox is on fire. Which nerve controls critical movements of the tongue? Remember your health assessment. A picture of that kid is really cute. And that's the cranial nerve 9, the glossopharyngeal. What type of breath sounds do you expect to hear over the trachea? When I was describing these breath sounds and why do we listen to those upper, sort of things, tracheas and bronchus, why? It's because all of that upper airway secretions. Is it that upper airway we're listening to, or is it these lungs sound that horrible? So over the trachea, it's your bronchial breath sounds. And we could say, yes, that's the upper airway. No, the lungs are okay. Depriving a child of food, clother, and shelter is. And I saw a story regarding this. It was two children playing in the front of the house with a ball and went out into the street and a car came by, tapped the child, wasn't hurt, but they called the police, okay? When the police came, they actually arrested the parents of the children, not because the child was in the street, but because it was 30 degrees outside and they had no coat on. That is neglect, okay? It's a true story. Which of the following immunizations is given in the adolescent stage? And that's the HPV, absolutely. And it could be boys and girls. ADHD most likely involves which of the following? That inattention, impulsivity, and hyperactivity. And remember, as a nurse, pull the parents in, talk to them, let them first express themselves. And then after you hear their story, make a plan of care that works the best. And last question. Adolescents typically place blank on peer relationships. I used to tell my children it was your buddies in them. Your buddies in them coming over, your buddies in them. It was like always, they always came to my house. I wanted to watch the children. So it was always at my house. And peers, very important. Number 3, Arika, good job. Number 2, Sally. Number 1, Fox. Number 4, and Jeanette, good job, and Carly. What I'd like you to do is sign your attendance attestations, make sure that they're done so you don't forget. Any questions for me? If not, we had a good day today. We are officially done. Anybody needs anything, just let me know. If not, I will see you next week. I will be sending your next review, probably Sunday. She'll post it, so I'll get it up as soon as I can. So good luck on your exams. Any questions, let me know before Thursday. I can help you. Okay?
Thank
Take
you.
care.
Thank you.
Take care, Ray. I love that.
All right.
Your name up as Ray.